Welcome to Living Vividly, the podcast where health, wellness, and curiosity collide. I'm Jackie, the founder of Vivid Health and Wellness, your guide on this journey to living your happiest and healthiest life. My co-host Daphne, the unconventional dietitian, is always ready to shake things up and bring a fresh perspective to your wellness journey. And we can't forget Dustin, our producer, who keeps everything running smoothly behind the scenes. Together, we'll chat with health and wellness experts along with everyday people who have inspiring stories and practical insights to share. If you're ready to nourish your body, move better, and discover simple ways to thrive, you're in the right place. And hey, if you enjoyed today's conversation, don't forget to leave us a comment sharing your thoughts, and subscribe so you never miss an episode. Today we're joined by Jill Daigle and Lennie Boulet with Urgent Care on the Go.
Right.
Today's episode is going to be a little bit different. Normally we're talking about different health
issues, challenges,
topics, but today we're going to talk about a business that's new to the area, and I'm really excited about it. It's called Urgent Care on the Go. So before we get into what the business is, why don't you tell us a little bit about yourself?
Okay. My name is Jill Daigle. I'm an RN. For the past 33 years, I think, you lose track. I worked at Lafayette General for 30 years in the ICU. Had different odd jobs, like in between that, I can't remember all of them, to be honest with you. I am now working at Park Place Surgery Center as well as Urgent Care on the Go. Lennie and I have been best friends since probably the 8th grade.
Oh, shy.
Yeah.
I know.
So sweet.
I know. He's been through a rough time.
That's why I drink.
Exactly. I've been married for 35 years, have 3 kids, 4 grandkids, and just trying to enjoy life and still, trying to complete that balance.
That's what it's all about.
Work-life balance.
Absolutely. That's it.
I'm Lennie Boulet. Been a paramedic for 35 years. We started Urgent Care Go about 6 months ago. Been married for 24 years. Got 4 kids, 3 we adopted through the state, and we got 6 grandkids. We're just trying to get the ball rolling on Urgent Care on the Go and getting the word out.
It's such a unique concept, Urgent Care on the Go. What made you guys open this?
Well, the owner actually used to have an ambulance service. I ran an ambulance service, and he contacted me and said that he wanted to open urgent care. I said, there's a dozen of them. What's so special about urgent care? He said, it's going to be different. So when he brought the concept to me, I'm going, yeah, I don't think anybody else is doing it. He said, nobody in the state's doing this.
So by on the go, it means that you are urgent care on wheels going to meet people at their own home.
Correct. We do have
facility.
a brick and mortar.
Okay.
But
Urgent Care on the stay.
Yeah. But we go to your residence. So anything that we can do in the clinic, we can do at your home.
And how is it being received?
Everyone who's used this loves it. It's just getting the word out. I ran across a couple of people this weekend who never heard of us, and they're right there in Rain. We've been on the commercials. We've been on the radio. We've written paper ads. We got Jill running around like crazy, talking to and introducing the business to different doctors' offices. So hopefully we can do collaboration with them and whatnot. But everyone who's used it absolutely loved it.
So walk us through the process. So I wake up in the morning and I am like nauseous, sick to my stomach, been puking all night long, and I'm not about to go to an urgent care because I don't know if I'll make it there with stuff coming out of both ends. And so what do I do?
Okay, you just call the number and schedule, and we open at 6 a.m.
Okay.
So we'll get out there. We'll do an evaluation on you.
So it would be a nurse?
It'd be one of the paramedics.
Okay.
We're going out, and then we'll call our nurse practitioner, do a telemed visit, and then probably give you IV fluids, maybe some antiemetics to where we can fix that situation.
So you can give me an IV in my own home?
Yes.
Okay.
And if we need antibiotics, we can do IV antibiotics. We can do oral antibiotics. We have them with us. We can call in prescriptions. So like I said, anything that the urgent care can do, we can do it in the comfort of your own home.
That's pretty incredible.
Exactly. Let's exaggerate this, Daphne. Okay. So let's say you're so sick and then you crawling to the phone. Okay. And you try to get up and you fall and you break your ankle.
Let's hope that doesn't happen, but okay.
And you don't know,
Really painting a picture
you don't know if it's broken, but anyway, we can do x-rays as well.
Yes.
X-rays on the go.
Yes.
We have a portable X-ray machine that we can load in the car and come out and do that as well.
That's
Yeah.
incredible.
So let's say one of your kids are playing football or whatever, we can even come out to the event. And
are y'all
do an
setting
X-ray.
bones and
No. If it's getting to that point, you have to go to the
Okay.
emergency room.
Yeah.
You're going to probably need a surgery.
But
and
even in
screws.
urgent care would send you to the emergency room.
Correct. Yeah.
Right.
We'll splint everything, but when things are that broken, you're going to need surgery.
So you can come to not just your home, but like a sports facility or a
Anywhere.
park.
If we can get there, we
Your campground.
Campground.
Anywhere.
Yeah. And I ran an ambulance service, and it never. We ran 4 ambulances, and at any time you're going to have 5 calls. It's just one of those situations. It's always going to happen. Most people we see within an hour from the time we get the phone call. So you're sitting on your couch and you're in your own home. You're not sitting in a waiting room with other people coughing on you. Yeah. If you're
Right.
not sick when you get there, you will be when you leave.
And most wait times in the
Yes.
urgent cares are like, you're looking around, you're like, I'm the only one. Well, I'm still waiting here for 3 hours.
Yeah. So you can do, so you can go anywhere. What parameters? What is your
We say anywhere in the
circumference?
Acadiana area, but it's 50 miles from Opelousas, so that covers most of the Acadiana area.
Okay. So you're based out of Opelousas.
Correct.
Okay. So you can go to any place 50 miles within Opelousas and do do anything that an urgent care would do. So if you're maybe young and like feel like you're dying, like deathly ill,
Yes.
or even for the elderly, or someone who is not as mobile to be able to get out or doesn't have really transportation service, this is a perfect option for those
Right.
people too.
And we service anywhere from 3 weeks on up. Okay.
wow,
So
okay.
that's our age. So
Did change it. It's 2 years.
Oh, okay.
There was some other issues legality wise, so we had to increase it to 2 years old.
Which is still young.
Yeah.
Yeah.
So from 2 years to 102, you can
Yes.
service these people. Okay. Okay. So IVs are you can do, and is it more than just like fluid IVs? Do you do any other types
We
of
can
IVs?
do vitamins. We can have antibiotics. It's medications. So as the paramedics, we did that in the field. So this is all stuff within our scope. We can do suturing, but the only place we won't suture is your face.
Okay.
Because of all the nerves. But we can do simple sutures. Pretty much, like I said, anything you can think of that urgent care can do, we will do.
yeah, we'll go in and swab you basically, for flu, COVID, strep. Okay. So we have access to do that. And then if you're positive for anything, we can start you on your first line of antibiotic right then and there, and then call in a script for you.
Okay.
Okay. And then also, of course, it's like Lennie said earlier in previous times, 75% of the people are dehydrated,
Yeah.
on a normal basis. So we can give you IV fluids with those vitamins and antioxidants to get you up and running, And then the elderly, especially if those that aren't feeling well, we can give them IV fluids, especially those who, that they don't like to drink, especially, So we go in and refuse them. That way their family member doesn't have to take off of work, bring them to the urgent care, wait half the day, and bring them back. So everything is convenient at your own home.
My mom's neighbor is 97 and she has a support system, but as far as like someone to pick her up and bring her somewhere, it's a little bit of a challenge to coordinate
the drop
that.
of a dime.
Right.
Right.
So
and
that's
especially
really
us taking Medicare now. I mean, it's so convenient for them. We
Yeah.
did a 92-year-old the other day. She had a UTI, so we just did the testing in her own home, helped her to the restroom, went back, sat her back down in her recliner, infused her, and gave her antibiotic,
That was going to be my next question. Y'all take insurance and all the...
Yes, Aetna and Medicare.
Yes.
And then,
we're waiting anytime. We've been getting a few calls from other companies that were pending. Whether that means 1 week, another month, I don't know, but they said we're pending. So hopefully when Blue Cross and United Healthcare, a couple of others, we'll announce it on our Facebook page and put the word out.
So it's coming soon. If you don't have insurance or if your insurance isn't covered, what is the cost?
$199.
Okay. So even if you get x-rays?
$199.
$199
regardless
across the board,
of what
no matter
services are done for that visit. It's
Yep.
Okay.
Really?
Yep.
Yes, so it's all one price. And then let's say you and your spouse are ill, okay? Then your spouse is half price.
Okay.
Right. So we there.
$300 for 2.
$300 for 2. Yeah, if you're paying cash. So
It's been slow growing right now and getting the word out, but I have a feeling that once this catches on and people start realizing that y'all are out there,
from your mouth to God's
you're
ears.
going to need a couple more cars.
Well, that's easy to get.
There's 2 in the driveway right now. So.
Cars are easy to get.
Yeah, that's awesome.
Okay. So if somebody is not like deathly ill, but I'm just chilling and I'm like, I feel like I'm a little dehydrated and I need some vitamins. A little hungover, yeah. We can just call you and it's $199 for an IV service.
Absolutely.
Correct.
Okay. What other services do y'all offer besides just the urgent care? Like
we do weight loss.
Okay.
With the infusion, we do the infusions. We are starting to work with another company to do the testosterone replacement and hormone replacements.
Okay. Let's talk weight loss for a minute.
Okay.
This is my realm. So y'all do weight loss injections, like the
Yes.
the compounded injections?
Yes.
And how does that work? What does that program look like?
So we're doing tirzepatide and semaglutide, which I know there's a little thing right now that they possibly couldn't shut it down, but we're still getting it. So
I don't think it's going to shut down. There's way too much money being made for it to shut down right now.
the tirzepatide is 125
Per injection?
per injection.
Does it matter what the dose is?
No,
Okay.
it's a flat fee. And the semaglutide is 100.
And flat fee no matter what the dose is.
Correct.
And so y'all come out and actually do the injection?
Correct. And weigh and check the vital signs, kind of keep them on track, coach them up on, and be their cheering squad for them.
Yeah, measure them, know, and then basically just educate them. A lot of people, need
So I was gonna
education
say, like,
on
here's
diet.
the big question.
Right.
Do they get any information on
Yes.
how they should change their diet?
Yes. Most people, by the time they get to the higher diets, they didn't switch. But I have most of our patients have switched to the caveman or the carnivore diet. They find it easier to follow.
That's a whole episode we'll have you back for.
Yeah. All right.
Not my recommendation, but
Yeah.
okay.
Yeah. But anyway, just basically see how they're eating and then tweak it accordingly to their likes and dislikes. So not everybody's going to say, okay, well, don't eat this for breakfast. It's what you like. And okay, let's see how we can tweak it according to every meal. And then that way it's individualized,
Okay.
Yeah, there's no diet sustainable if you don't like what you're eating.
Yeah, it's a transition. It's a transition to a healthier lifestyle. So we just encourage people that this shot is not forever. It's just basically a transition to a healthier lifestyle.
Yeah. So what else do y'all do? You said the hormone replacement.
Yeah, we're looking into doing that. We did start doing some of the TRT, but our nurse practitioner just spoke with some people to do about the women's hormone replacement. So
So
that's
for
the process.
testosterone, you're doing injections, pellets.
Injections.
Okay.
Yeah. Pellets, we're kind of staying away from that.
Okay. And then what other types of hormone replacement types of things?
Well, that's what I'm saying. We just getting into that.
Okay.
And we do have NAD on the table as well.
Yes.
But
That's good
that's
stuff.
not executed yet.
Right.
Like NAD IVs.
Yeah.
Okay. Did y'all do the injections of those yet?
No,
No?
not
Okay.
yet. It's fresh on the table, so we're discussing and getting all the logistics.
I know people love the NAD. My husband is an NAD junkie.
I know. I cannot wait to start it
Yeah.
and try it.
It really does help mental focus, the sharpness, the recall. It's pretty incredible. I mean, your body uses NAD in the energy cycle. So I know as we get older, that slows down, and I've seen a huge difference with him, especially like high performing professionals and even athletes. So once y'all start doing that, it's going to be, I'm sure it'll be popular. Whenever I had Vivid, the infusion clinic, that was one of our most popular things, especially when we got into the IVs.
Tell us about the cannabis program that you have.
Ooh, yeah, you got a pin.
Yeah, so we actually just got in with Apothecary. So you just call in. You can actually just go to our website and follow the steps. It'll basically ask you information, you prepay, and you get your card, and they send it to whichever apothecary or whichever cannabis store.
So what
pharmacy.
are the qualifications to get?
It's actually pretty simple. It's on the website, but from anywhere from anxiety to
a stubbed
Lack
toe.
of sleep. Yeah. Just
I mean, there's
Insomnia.
actually a long list, and it's pretty simple. There's almost no one can't qualify. To be
Okay.
honest with you.
Okay. And so then it gets called into the apothecary, and what are they actually getting from the apothecary?
So when you get to the apothecary, they actually talk to you, find out what your needs are, and they prescribe you which level you should start
Recommend
with.
a blend.
Whether it's the gummies or the flower or actual pot to smoke or however.
what you prefer. And also,
Yeah.
and Lennie, our apothecary's on Bertrand, huh?
Correct.
Is that, yeah. And so you may see some signs, around the area saying free cards. and our cards are
They're $149 for the first time, and a renewal is $89.
Okay.
It's a good price.
And then, but those free cards, then you have to go to the apothecary and
Wherever they offer it.
right.
You can only
So
use their
it's not
stores.
as close as Bertrand.
Oh, okay.
But, they're actually building a new one in Opelousas.
Oh, in Opelousas too. They're building a new one on Ambassador as well.
Oh, okay.
This program is something that I'm not familiar with. You're more familiar with
Very
it.
familiar with it.
So tell us.
Yeah, tell us. Walk us through
I've
this.
had my license for a few years now, and whenever I got it, it was a telemed visit, and you just talk to the doctor, tell him, whatever issues that you're having. You go through a medical history, and it was pretty straightforward. Maybe a 10-minute conversation.
Exactly.
You're like, approved.
And it's still that way now.
Yeah.
It's a telemed visit, literally 5 minutes,
Okay.
start to finish. That you schedule a time. The nurse practitioner will call you, and you're done quick.
Basically, make sure you're of sound mind. You got
Right.
an issue that you need some help with, and
And then you have a card where you can get
So when you
whatever
go
your needs
to,
are.
let's say, apothecary, whatever you purchase, whether you buy the gummies, is going to have your prescription on there and everything. Yeah.
Okay.
so it's a year-long prescription. So at the end of the year, you just have to renew. Mine's actually overdue, or not overdue, coming due. So
Give us a call.
I'll renew with you.
And you can choose basically what you want
Yes.
when you go to the apothecary.
Yeah. Not everything's right for everyone, but heck, I didn't even know there's tinctures, there's gummies, there's, like I said, flour. I didn't even know that existed. You can smoke it, or they have it in the vape pens. There's just a ton of stuff that I just was very unaware of.
There's also just indica, sativa. Your body reacts to them differently. It's very, very interesting. My husband's from Michigan, so up there it's recreationally legal. So you go to the dispensaries up there, and it is down by the percentage, like this much sativa, this much indica, this much THC. It's the harvest date. It's very scientific. Like they're not just growing weed plants and
Correct.
giving you random stuff. Like they know, whatever. There's like a plus or minus. There's a wiggle room of percentage, but it's pretty.
Yeah, if it's more anxiety related, they'll tell you this. If it's I can't sleep at night, they'll prescribe this one. Those guys are professionals out there. They really know it backwards and forwards.
So they'll direct
It's a
you
real
what you need according
pharmacist.
to your symptoms.
Exactly.
Because
Exactly.
for you to have to go educate yourself on all this, that's a whole nother,
Yeah.
Yeah.
So it's truly plant medicine.
Yeah. I mean, it's run by a real pharmacist. It's a legitimate thing.
A lot of veterans, traumatic stress, it helps them, to cope,
Yeah.
to live day to day. So it's great stuff.
And then we also have our heroes discount. Speaking of veterans,
Yes. So veterans and first responders get a discount on medical needs or IV supplies. We were doing a promotional on the weight loss, but that's over. So it's just right now it's on urgent care or IV infusions, but they get a 25% discount.
and
That's really good.
firemen, policemen,
EMS and veterans.
and veterans.
Is there a senior discount, or is it just?
No, it's just for those. The seniors, most of them will be on Medicare and stuff.
Yeah,
so
that's true. Covered.
So after somebody gets some type of urgent care situation, they would then be for follow-up. They would be recommended just to go follow up with their primary care doctor.
Yes.
Okay.
Yes.
If need be.
Yeah.
Okay.
Yeah, most of them.
It's like a one-time thing.
Yeah, we don't want to be anybody's primary. Like I said, we very much would love to work with other doctors. Hey, send us your patient when you can't get to them.
Yeah, after hours.
Yeah, or even like, hey, Ms. Jones is sick. I'm booked. I cannot get to her. Can y'all go see Ms. Jones for me? And then send us a report. We'd be glad to do that.
It's so interesting that you say that, because there are a lot of people who, whenever I interview people, I ask them, like, who's your primary care doctor? And a lot of people are like, when I get sick, I just go to urgent care. So they don't really have a primary care, or maybe they had a primary care that they've seen like 2 or 3 years ago, but not somebody that they actually follow up with. So lots of people use urgent care as just kind of their go-to whenever needed.
Especially younger ones.
Yeah.
Yeah. In your 20s and 30s, you're never sick.
Yeah,
so.
you're like, primary care, what's that?
Yeah, what's that? Yeah.
Do y'all do any kind of labs?
We can do labs there, and we can send off to LabCorp.
So what type of labs can you do?
Well, anything LabCorp can do, we can draw and send it off to them. But we have just a quick iStat that we can do at the office to
Okay.
get some basic labs.
Okay.
It's a very limited lab, but it does cover some of the key
So like a
points.
CBC, a CMP.
We have to send off.
You have to send that stuff out. Okay.
Yep.
I have a centrifuge in the back of my car. It's been in the back of my car for 6 months. I cannot get in touch with the lab that we used to work with. So I've been riding around with a centrifuge in the back of my car like a psychopath.
Conversation piece.
Yeah. Like, what is this? Don't worry about it.
That's interesting. Cool. So what are y'all's hours?
6 a.m. to 6 p.m.
7 days a week?
6 days a week.
6 days a week.
Yep.
Closed on Sunday.
Yep.
Correct. And then the office is open from 9 to 6. Correct.
In
The
Appaloosa,
brick and
yeah.
mortar.
So if someone wants to book an appointment, they call the number. Is there a website as well?
UrgentCareOnTheCo.com.
You can't schedule through the website yet. Now, if you're going to call for the marijuana, you can go through Healy, which is on that link, but that's only for the marijuana cards right now.
Okay. Sounds good. And you do that in person, or is that a telehealth?
That's telehealth for the cannabis. Everything else is someone goes out to you.
Fantastic. That's really exciting.
Yeah,
And I
very
know
cool.
you said you're going to post our information, but the number is 1-888-381-4904.
Actually, one of my good friends called you guys out last week or the week before. As you know, I used to have an IV clinic. She was like, "Diane, I have a stomach bug. I don't know who to call." It's like, call Urgent Care on the Go. And she said it was wonderful. And she sent me a picture from her sofa and got her back in business.
Yeah.
So that was awesome.
Yeah.
Very cool.
She was pregnant, huh?
Yes.
Yeah.
Yeah, I was
so-
all worried about her. She got a stomach bug and
Yeah.
pregnant.
We service quite a few women who have hyperemesis gravidarium throughout their pregnancy. You know.
Yeah, it's a major issue.
Yes, it truly is. My daughter had it as well. It's horrible. Horrible.
I mean, so many women relied on that to get them through their pregnancies. So I'm glad that y'all are able to, because that was actually a question that I had when I called you. It's like, can y'all see pregnant women? Because some people are funny about that. But she's very happy that she called you guys.
Saves
So-
them a trip to the ER.
Absolutely.
You know? And it saves a lot of people a trip to the ER. That way, you know, it's like Lennie was saying earlier, it keeps those rooms open for people who truly
Right.
need that emergency situation.
And save a ton of money. A trip to the ER, if you get just a little bag of saline, which we know what that costs, they're still paying a couple $1,000s at the end of the day.
Oh yeah, definitely. It's like minimal 3,000. You know, so much for the physician to walk in your room, and so much for the room. And then you're not going to be getting the vitamins and antioxidants in those IV fluids.
Right. You're just getting saline.
So
Right.
yeah,
You know,
it's working on the AMLA side. Everything costs. You got to multiply the supplies, and this is we ain't trying to get rich. We're just trying to help people and pay the bills at the same time.
It sounds like a great contribution to the community. And I have a feeling, like Jackie said, once this catches on, it might be slow going now, but once it catches on and people are, like I said, I'm thinking, I don't know why, because my son doesn't really play sports, but like at a summer sports event where you've got multiple kids and parents that are out there for hours and hours and hot, and like somebody's dehydrated. I mean, to call Urgent Care on the Go, get them out there, get some hydration going, and then just get back on the field. You know, that could be a simple, easy fix whenever, you know, our summers start getting really, really hot, really, really early.
right. And
So-
they can do prevention as well. Like done teams to where, like if you're right before a championship game, you know, those guys who've been practicing all week long, then you can do it before. And like
Yeah.
even if you're getting married, the bride and the groom, you know, a lot of people have come to us in the morning.
Yeah.
You know,
They partied too hard the night
correct.
before.
We book them, and in that
Or
way,
they know they're gonna party too.
right. So you know, you hydrate them prior to their wedding
Yeah.
on their wedding day, and then you know they have a great night.
Yeah.
You know, you're visiting with a lot of people. You're exhausted from the week, but you can pre-infuse rather than post-infuse.
Right. Very cool. It sounds like a great addition to the community. So I'm excited to see this getting
Yeah, I
going.
can't wait to see how many more cars you guys need.
Yeah, I hope so. I hope it gets to that.
Yeah.
That's where I want to be, is on the road.
Yeah, that's not a problem. We Kia sells cars, so we'll just keep adding to the fleet.
It's got to be really cool to go into different people's homes to kind of see the cross section
So
of all the.
it's actually pretty awesome. You know, as a paramedic, we do that.
Yeah.
Okay, but we don't get paid if we don't take you to the hospital. You know, this is you coming in. They're not deathly ill. They just need X, Y, or Z. You know,
Yeah.
we give them a steroid shot, leave them a Z-Pack, and They didn't have to pay for the medicines. If we have it with them, that's part of the plan, and you don't have to worry about going to the pharmacy even. So yeah.
Right. And, just having nice conversations with people, a different perspective of healthcare for myself, rather than ICU where you couldn't hardly have conversations. Most people are on the vent.
Yeah.
So you just connected with the family members, but now it's actually with the patient,
Even in just an urgent care, like it's not comfortable. They're not in their home. People just don't feel.
Well, there's not the personalism in an urgent care. You come in, you get out, it's all fast paced, and then now you actually get to have a conversation, and then you relate it to half the people you treat.
That's true.
So it makes it nice. It really does.
And what's really neat too is we notice on average when we get to someone's house, we're out of there in 20 minutes, so they can get back on with their lives.
Yeah.
They're not waiting along forever in a waiting room.
So much time.
And then having to get brought in the back, and then they sit and waiting for someone to come see about them. Then someone comes take their blood pressure. Then someone comes back to give them a shot a little later. And so we're usually in and out there pretty quick.
Yeah. It's not an interruption of basically life.
Correct.
We've done business offices as well with lawyers, and where they still on their computer typing, and, we have everybody hooked up.
They don't have time. They can't afford to take
so
off.
they're still answering the phone, working as we're infusing. So you don't have to actually stop to get this done.
We've gone to sick moms, got 3 kids.
Yeah.
Don't have family close by. So what they got to do with the kids? They got to drag them with them.
Yeah.
They got to load them up.
It's a nightmare.
Kids are screaming. They don't feel good. So we just go to their home. I mean, it's a simple concept, but it really helps out everyone.
Yeah.
And if we have a family that basically sometimes all the kids are sick and the mom and dad, so the max that we'll charge you is $300. So your kids are basically free.
Yeah.
Swab them all.
Yeah, check them all out while you're there.
Especially these days. My mom went into an urgent care actually recently. She had poison ivy all over her body. She's very allergic. And she lives in the country. She's always in her garden. So once a month she gets poison ivy. So she went in to get a steroid shot and got COVID in the waiting room.
No way.
Yeah. So having this would have been so convenient. And she's in St. Landry Parish.
Right there.
Called y'all.
Yep.
Yeah.
Next time.
There you go.
It's just not hardwired yet.
Yeah.
So people don't think, okay, well, let me call.
Yeah, when you're the first at something, people don't know it exists, so they don't think about, let me look up mobile urgent cares,
Yeah.
But we live in that time. I mean, I barely go to the grocery store anymore. Like, I'm going to order some groceries and they'll be here in an hour.
Well, and I think it's a generational thing, because since COVID, that's kind of how we operate. But the older population does not really think of that. But I think if you think about the transition from when urgent care first started, and whenever the mentality was, I'm sick, I have to go to the ER. You have to go to the ER. And there's wait, there's a stop before I get to the ER. That transition took a long time too.
It did.
And taking those type of situations out of the ER was such a change for the emergency room experience, because now they're actually treating emergencies and not treating, a respiratory infection. That's made a big difference. So it's going to be a transition to go from, okay, now I can stay home and I can have urgent care come to me. I don't have to go to the ER, and I don't even have to get out of my house. So that it's going to be a transition time. But I think once it catches on, y'all will have
revolutionary.
multiples. Yeah.
For sure.
Right. And I mean, when you get to, I've gotten to some people's homes that they're truly not feeling well.
Yeah. The last thing you want to do when you're not feeling good is get in your car and have to travel somewhere.
Exactly. So, I mean, there were times people didn't even get out of bed. You just went in, did what you had to do in their room for the privacy. So they never even got out of their bed. I've infused people in their bed, in their own sofa. Hey, the door's unlocked. Go ahead and come in. I'm not getting up.
Yeah.
Lennie went in the other day and she said, okay, lock the door when you leave. And that was it. You never got up.
That's great.
Yeah. That reminds me of one of our first home visits that we did at Vivid. This poor guy had food poisoning so bad and he was home alone. And this was still we're in COVID days, so my coworker and I show up in full PPE and we looked like a sci-fi movie. We're going into a situation and he's not answering the door. So we're okay, and open the door, and he's on the ground in the living room, just
oh my goodness,
miserable. Poor guy. He couldn't even get up to answer the door. And we were there for a few hours and we brought him back to life, but he desperately needed someone to come to his house. There was no way he could have made it anywhere.
And it's great to to leave them feeling better.
Yeah.
You know,
you
she made
saved
a
my
difference.
life.
Yeah.
Yeah.
Made a difference.
And that's going to be what continues your business. Like word of mouth is the most powerful marketing. You could pay for all the billboards, any marketing. It's the people that have had the experience that know y'all are awesome. That's going to exponentially grow your client base.
It's very, very personable. You know, it truly is. It's not just about going in and out. It's just about getting to know people and connecting.
Yeah. And y'all are fun. Like who doesn't want to hang out with y'all?
Oh, we
at their
laugh all
house?
the time. I'm like, I've never, every house I go into,
My new best friend.
even though you're sick, you know, you're going to at least put a smile on somebody's face.
Yeah.
Yeah.
You know?
That's awesome. Just to be clear, you don't help with hemorrhoids.
No. No, we do not. Definitely
That's
do
not considered urgent enough, I guess. Yeah.
We don't have any creams or anything, Lennie. I mean, I'm sure we could prescribe something.
Like some steroid on it.
Yeah.
Yeah, we can give you some creams or something, but that's it. There will be no pushing them back in.
God.
Good to know. So something we ask all of our guests before we let them leave, before we let them escape. What does living vividly mean to you?
Living vividly is balance, serenity, peacefulness within, and taking time for stillness, meditation, and love.
And I'm going to add being just satisfied. People always chasing something, and they overlook just the blessings that they have already. So just being satisfied.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.